All right, everybody, Dr. Reusch here from Vet Triage. We are continuing through this issue of JAVMA from July 1st, 2015, and we're going to be talking about diabetes mellitus in dogs. Detemir insulin for the treatment of diabetes in dogs. This study comes out of the vet school in Italy as well as the vet school in Switzerland. The objective is to investigate the effects of insulin Detemir in dogs with diabetes mellitus. It's a prospective, uncontrolled clinical trial, 10 dogs. Procedures: Detemir subcutaneous every 12 hours, 6 months. Follow-up at 1 week, 2 weeks, 4 weeks, 12 weeks, 24 weeks. Evaluation of clinical signs and blood glucose and serum fructosamine. Results found significant decrease in blood glucose and fructosamine concentrations at 6 months. The mean insulin dose 0.12 units per kilogram or 0.055 units per pound. Hypoglycemia was seen in 22% of dogs. A subjective improvement in clinical signs in 100%. At the end of the study, it was considered good control in 5 dogs, moderate in 3, poor in 2. So 50% good, 30% moderate, 20% poor. Conclusions: it is a viable treatment. Insulin Detemir should be used in caution, especially with smaller dogs. Introduction. Insulin types commonly used for the treatment of diabetes mellitus in dogs include porcine insulin zinc suspension, recombinant human NPH insulin. NPH is neutral protamine hagedorn, recombinant human protamine zinc insulin, and insulin glargine. Insulin analogs are modified forms of insulin that differ from native insulin but have the same physiologic effect. Glargine and Detemir are synthetic long-acting insulin analogs designed to maintain a basal concentration of insulin in humans with diabetes mellitus. Glargine forms microprecipitates in the subcutaneous tissues, so it creates a slow absorption, long duration in humans, dogs, and cats. Insulin glargine is considered by some to be the insulin of choice for the treatment of diabetes mellitus in cats, and one study showed that the remission rate of diabetes was higher in cats treated with insulin glargine than in cats treated with other types. Insulin Detemir differs from human insulin in that the threonine in position B30 of the primary amino acid sequence of the polypeptide chain has been removed, and the epsilon amino group of the lysine in position B29 has been acylated with a 14-carbon myristoyl fatty acid. The fatty acid modification permits insulin Detemir to reversibly bind to albumin, which slows absorption and provides a prolonged and consistent metabolic effect for up to 24 hours in humans. Insulin Detemir has a great potency than do other insulins, and as a result should be used at lower doses. Materials and methods. The diagnosis of diabetes was based on typical clinical signs: a blood glucose concentration of over 200 mg per dl after food has been withheld for at least 10 hours, glucosuria, fructosamine over 340 micromoles per liter. At the time of enrollment, dogs were considered to have poorly regulated diabetes if they had polyuria, polydipsia, polyphagia, weight loss, with blood glucose over 200 mg per dl throughout the 10-hour period, despite treatment with insulin at doses of 0.5 units per kilogram or higher, sub-Q every 12 hours. Insulin Detemir was administered in all dogs starting at 0.02 to 0.13 units per kilogram, sub-Q BID. To avoid errors in administration in very small amounts of insulin, a diluent was used in one dog that weighed less than 5 kilograms or 11 pounds. A diet low in simple carbohydrates and high in fiber was recommended for all dogs, but the diets did vary because they let it up to the owners to decide if they want to change it or not. For blood glucose concentration curves, food and insulin were typically administered in the clinic. Glucose concentrations were measured before and 2 hours, 4 hours, 6 hours, 8 hours, and 10 hours after insulin injection. The aim was to maintain a blood glucose concentration between 90 and 270 mg per dl. Mild hypoglycemia was defined as glucose between 60 and 89 mg per dl, and severe was less than 60. A blood glucose concentration curve nadir of 90 to 180 mg per dl was considered ideal. An optimal blood glucose concentration is one that had over 50% of the blood glucose concentrations in the range of 90 to 270 mg per dl. Glycemic control was considered good, moderate, or poor for blood glucose concentrations of less than 234 mg per dl, 234 to 306 mg per dl, and over 306 mg per dl, respectively. Glycemic control was considered good, moderate, poor, with fructosamine if it was less than 450 micromoles per liter, 450 to 550 micromoles per liter, and over 550, respectively. Glycemic control was considered good, moderate, poor on the basis of owner observation if polyuria, polydipsia were absent, present but improved, present and unchanged, respectively. All right, results. Median age 9 years, mostly female spayed. Median body weight 9.6 kilograms. Median body condition score out of 9 was 5. Most dogs are English setters. Outcome, median insulin dosage at the time of the study enrollment was 0.11 units per kg, sub-Q every 12 hours. The dose was increased in 70% of dogs. The median dose at the end of the study was 0.12 units per kilogram, which was significantly higher than the initial insulin dose. The median glucose concentration for the blood glucose curve was significantly lowered at weeks 1, 2, and 24 than they were at the initial insulin Detemir treatment. At the end of the study, blood glucose curves were classified as optimal in 50% of dogs. Overall, 44% blood glucose concentration curves were classified as optimal. When all 45 blood glucose concentration curves were considered, the nadir most commonly occurred 4, 6, or 8 hours after giving insulin. So 4 hours was 22% of curves, 6 hours, 27% of curves, 25% were 8 hours. Fructosamine concentrations significantly decreased after 6 months of treatment compared to the time of enrollment. Adverse effects. No adverse effects were seen. Mild or severe hypoglycemia, meaning 89 mg per dl or less, was a frequent problem and occurred in 60% of dogs, 22% of blood glucose curves. Severe hypoglycemia, so less than 60 mg per dl, 30% of dogs, 9% of curves. All right, discussion. In the present study, administration of insulin, Detemir, subcutaneous every 12 hours significantly decreased blood glucose and fructosamine and was associated with good to moderate efficacy determined on body weight, stability, physical exam, glycemic control in 80% of dogs. Insulin glargine and insulin Detemir have similar effects in humans. Detemir likely has different pharmacokinetics in dogs and is potentially higher potency in dogs compared with other insulin types, may be attributable to the concentration of insulin in current preparations, which is 4 times as high, 24 millimoles per liter, as the concentration of insulin in NPH insulin and glargine, which is 6 millimoles per liter. Also, it's possible that albumin binding capacity of insulin Detemir in dogs differs from humans, making it more potent. The median dose of insulin Detemir at the end of the study was 0.12 units per kg. The dosage of other insulin types is typically much higher and range from 0.5 to 1.0 units per kg sub-Q every 12 hours. The Samoyedji effect may occur when an insulin preparation with a duration of effect over 12 hours is administered every 12 hours. Owners reported clinical signs associated with low glucose in 40% of dogs. Similar studies in other insulin types in dogs have lower rates. Clinical signs compatible with low glucose was reported in 38.6% of dogs treated with porcine insulin zinc suspension in a study, and 17.6% of dogs treated with protamine zinc insulin, but for no dogs treated with insulin glargine in other studies. With other insulin types, dosage changes usually range from 5% to 20%. For technical reasons, the insulin dosage was usually adjusted in increments of 0.5 units per dog in the present study. In the author's opinion, the specific insulin diluent should be recommended for all dogs that are less than 10 to 15 kilograms or 22 to 33 pounds. Without the availability of diluent, it's not recommended to use this insulin in dogs that are less than 10 to 15 kgs. For dogs in this study, the time when the glucose concentration nadir occurred was highly variable, although in most instances it was seen 4 to 8 hours after insulin was given. In a previous study, the time to peak effect was 8 to 10 hours, depending on the insulin Detemir, demonstrating the insulin Detemir is long-lasting not only in humans but also in dogs. Local, immediate, or delayed reactions to insulin have been reported in humans with Detemir, and a small number of anaphylaxis in reaction to insulin have been reported. In this study, there was no local or systemic reactions reported. The only insulin preparation currently approved for dogs with diabetes mellitus is porcine insulin zinc suspension, even though veterinarians frequently recommend other types of insulin. So yeah, I mean, weaknesses of the study, obviously, we need more control. The diet wasn't controlled and for these dogs, and also we need more dogs. There's only 10 in this study, so it's hard to say for sure. But anyway, diabetes is so common, and at least it gets the ball rolling on testing a certain type of insulin, and so which is helpful. So for veterinarians, realize that there are other options out there, even though the majority of these are not approved for use in dogs outside that porcine one. And for pet owners, if you're having difficulty controlling your dog's diabetes, don't forget, there are other options, and she'll definitely speak to an internal medicine doctor. Also, let's emphasize too, to both veterinarians and pet owners, the quality of diabetes control is not always based on blood work. Clinical signs matter a lot. If the glucose is not normal, but that dog's not showing symptoms of diabetes, then it might be that's an okay level of control for that dog. So don't always go based on the numbers. Definitely go based on clinical signs. All right, thanks guys. We'll see you again tomorrow. Bye-bye.